Hello everyone and welcome back to the channel. If you've recently been prescribed prednisolone, are currently taking it, or perhaps you've been told that steroids may be part of your treatment in the future, you're probably wondering whether prednisolone is safe, what side effects you should expect, whether you'll gain weight, how long you can stay on it, and whether the benefits outweigh the risks. Prednisolone is one of the most effective medications we have in rheumatology, but it is also one of the most misunderstood. Patients often hear frightening stories about steroids causing osteoporosis, diabetes, weight gain, moon face, mood changes, and long-term complications. Understandably, this creates a lot of anxiety. In this video, I'm going to explain exactly what prednisolone is, why rheumatologists use it so frequently, the conditions it treats, how quickly it works, the common side effects, the long-term risks, and perhaps most importantly, how we can use prednisolone safely and effectively. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Prednisolone belongs to a family of medications called corticosteroids. These are synthetic versions of cortisol, a hormone naturally produced by the adrenal glands. Cortisol plays a vital role within the body. It helps regulate inflammation, metabolism, immune function, blood sugar levels, and our response to physical stress. Prednisolone mimics these effects, but at much higher doses, allowing us to suppress inflammation rapidly and effectively. This is why prednisolone remains one of the most powerful anti-inflammatory medications available. In many situations, it can work within hours or days, and patients frequently tell me that they felt dramatically better shortly after starting treatment. People often say, "I felt like a different person within a few days," or "For the first time in months, I could finally move again." This rapid improvement is one of the reasons prednisolone continues to play such an important role in modern rheumatology, despite the availability of newer medications. We use prednisolone to treat a wide range of inflammatory and autoimmune diseases. These include rheumatoid arthritis, polymyalgia rheumatica, giant cell arteritis, lupus, vasculitis, inflammatory muscle diseases, psoriatic arthritis, connective tissue diseases, sarcoidosis, and many other conditions. Sometimes steroids are used for a short period to gain control of inflammation quickly. At other times, they are used as a bridge while waiting for slower acting medications such as methotrexate, hydroxychloroquine, or biologic therapies to begin working. I often explain this to patients by comparing prednisolone to a fire extinguisher. It works extremely quickly to put out the inflammatory fire, but it isn't always the best long-term solution. Once the inflammation is under control, our aim is usually to introduce treatments that keep the disease suppressed while gradually reducing and eventually stopping steroids whenever possible. One of the questions I am most commonly asked is how quickly prednisolone works. The answer is often surprisingly fast. Patients with polymyalgia rheumatica can experience dramatic improvement within a few days. Individuals with active rheumatoid arthritis may notice significantly reduced swelling and stiffness within 1 to 2 weeks. Patients with vasculitis, lupus, or giant cell arteritis can also experience rapid improvements, which is why prednisolone can sometimes be life-changing and in certain situations, even life-saving. The dose of prednisolone varies considerably depending on the condition being treated. Some patients may only require 5 or 10 milligrams daily, whilst others with more severe disease may need 40 or 60 milligrams. In medical emergencies such as severe vasculitis or giant cell arteritis, we may even use high-dose intravenous steroids to bring inflammation under control as quickly as possible. Of course, if prednisolone works so well, many patients understandably ask why we don't simply continue it indefinitely. The answer lies in its side effect profile. Steroids are incredibly effective, but they can cause problems if used at high doses or for prolonged periods. As rheumatologists, our goal is always to use the lowest effective dose for the shortest possible period of time. The most common side effects patients notice early on include increased appetite, fluid retention, sleep disturbance, and mood changes. Many patients tell me they suddenly feel much hungrier than usual and develop cravings, particularly for sweet foods and carbohydrates. This can contribute to weight gain over time. Others notice that their face becomes slightly fuller, their clothes feel tighter, or they simply feel more puffy. Sleep can also be affected. Some people feel energized and productive, while others experience insomnia or restlessness. This is one reason we generally recommend taking prednisolone first thing in the morning, as this better mimics the body's natural cortisol rhythm. Mood changes are another recognized side effect. Some patients feel more emotional, irritable, or anxious, while others describe having increased energy or feeling unusually upbeat. Family members are often the first to notice these changes. Longer-term use of prednisolone can lead to more significant complications. Perhaps the most important for rheumatologists is osteoporosis. Steroids reduce bone formation, increase bone breakdown, and interfere with calcium balance, all of which increase fracture risk. This is why we frequently recommend vitamin D supplementation, calcium intake optimization, DEXA scanning, and bone protection treatments for patients requiring long-term steroid therapy. Prednisolone can also increase blood sugar levels and may contribute to diabetes, particularly in individuals who already have risk factors. Blood pressure may rise, cataracts and glaucoma can develop, skin can become thinner and bruise more easily, and muscle weakness may occasionally occur with prolonged exposure. One side effect many patients worry about is the so-called moon face, which describes the rounded facial appearance that can occur with higher doses of steroids over extended periods. Fortunately, this is often reversible as steroids are gradually reduced. Despite these risks, I always remind patients that prednisolone is not a medication to fear, it is a medication to respect. Used appropriately, prednisolone can restore mobility, prevent organ damage, preserve eyesight, and dramatically improve quality of life. The key is careful monitoring, thoughtful prescribing, and a clear strategy for reducing the dose whenever possible. Perhaps the most important practical point to remember is never to stop prednisolone suddenly without medical advice. Over time, the adrenal glands reduce their own cortisol production, and stopping steroids abruptly can leave the body temporarily unable to produce enough of this vital hormone. This is why steroids are tapered gradually, allowing the adrenal glands time to recover normal function. Modern rheumatology has become increasingly focused on minimizing steroid exposure, but prednisolone remains an incredibly valuable treatment. Few medications work as quickly, and few treatments provide such rapid relief for patients who are suffering from severe inflammation. If you are taking prednisolone, the most important message I would leave you with is this. Understand why you are taking it, understand the potential side effects, ask questions, and work closely with your specialist to ensure you are receiving the maximum benefit with the minimum possible risk. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on rheumatoid arthritis, PMR, osteoporosis, lupus, vasculitis, and rheumatology treatments, make sure you subscribe to the channel. Thank you very much for watching.